But Dr. Goodman, I want to get to you. You've been an expert in this field. You've written many papers, worked on legislation. Why is healthcare so expensive?
Healthcare is expensive because of federal regulation. So Beth put her finger on two huge problems that I want to draw your attention to, and they should be big issues in this election. For millions of people, healthcare has simply become unaffordable. The premiums are out of sight, the deductibles are out of sight, and that is not a natural, normal thing in a normal marketplace. That is a result of bad government policy. So if you're a family of four and you do not get a subsidy from the federal government, and you take the average premium and add it to the average deductible, right now it's $25,000. That's the average nationwide. The family has to spend that much money before its health insurance kicks in. That's not affordable. And that's in the individual market, which is totally regulated by the federal government. But many employer plans for low-income employees and small businesses are almost that bad. And then Beth mentioned the issue of quality. What has happened is the networks that these plans are attached to have become more and more narrow. So even Blue Cross here in Dallas, even its plans are extremely narrow. And this may surprise all of you, but you cannot buy individual insurance in the Metroplex that will get you into UT Southwestern Medical Center, which is one of the premier medical institutions really in the whole world. You can't buy individual insurance in Texas that gets you into MD Anderson Cancer Center down in Houston. And this is happening all over the country. So two really bad things. Health insurance has become unaffordable unless you're getting a huge subsidy. And the quality of what you're buying is really bad. And let me just say one more thing about what the Democrats just did in Congress. Their solution to this problem is to spend a lot more money. And where does that money go? It doesn't go to you, it goes to insurance companies. And why is that? Because if they gave it to you, you wouldn't buy the plans that are out there in the market. Would you would you buy insurance with your own money? No, you'd go do something else. And so their answer is great for insurance companies, bad for you.
You know, as we talk about the cost of things, federal regulation, we've talked about inflation. Let's go back to Obamacare. It's over 10 years ago now, but we know premiums went up. People lost their insurance. They lost the doctor they wanted. My own wife had her premiums double and was dropped from her insurance in a given 1 month period. Then we had to pay tax penalties for that. So looking at that, those were a lot of surface level things people saw. What was happening under the surface? We were talking at lunch one time. This hurt even poor people by introducing Obamacare and more federal regulations. Dr. Goodman.
Oh, okay. Well, some of you may remember when Obama was running for president, they first said, well, we want to insure the uninsured. And then Chuck Schumer pointed out, well, you know, uninsured people don't really vote. 95% of all the people who vote have insurance. So then they changed the rhetoric and they focused on pre-existing conditions. And they said, you know, that if you have pre-existing conditions, you can be denied insurance and denied care. It turns out that if you have a chronic illness and you have to leave work and go to the individual market in Dallas, Texas, you were better off way back then than you are now. Because way back then, if you were denied insurance, you could go to the Texas risk pool. What was that? It was a standard Blue Cross plan. You could see any doctor, any hospital just about in the Metroplex. It cost a bit more, but you had access to the doctors you need. And today you don't. So things got worse, not better, if you have a healthcare problem.
Thank you, Dr. Goodman. Congresswoman, we know Obamacare is the law of the land, but how can we sidestep this? Can we just ignore it and provide people across the country just other options?
Well, I mean, I think Republicans actually tried to kick something across the goal several years ago. As you know, by one vote, it lost. Part of the problem is you can't just repeal something that so many people are reliant on now. You know, once you start a government program and you start getting people signed up for it, you can't just pull the rug out. What you can do is, one, take away the mandate, which is what they actually were able to accomplish in Congress, so not everybody has to be on that. But two, offer up other options. Again, offer up things that people can personalize to their own needs, to their own pocketbooks. It doesn't have to be Obamacare. But in Congress, everybody has this like idea that people in Congress have phenomenal benefits. Do y'all know that we are actually on Obamacare? So as congressional members, that was, I don't remember when that went into effect, but that we are required to be on the Affordable Health Care Act. And our coverage is terrible. And to your point, Dr. Goodman, you know, when Obama came in and he created that system, 85% of people were already covered somehow for healthcare costs, or were already on some type of plan, and were happy with it. Why they had to come in and affect 100% for the needs of 15% was beyond most people's understanding. It made no sense. And again, what we've seen is decreased access, decreased quality, and increased price. What you can do as far as policy is offer up as many options, allow competition to reign, allow people to be able to pick and choose what they want, and set the free market on fire. One size fits all is ridiculous. I am not a man. I'm not worried about prostate cancer. I am in my 50s. I'm not worried about being pregnant again. So why am I having to cover those costs? I shouldn't have to. My kids are out. They've got their own insurance now. Why am I still having to pay for, pediatric visits? We should be able to pick and choose, allowing the money that you make to be able to be spent on healthcare costs, for example, and I don't know if you want to get into HSAs yet.
Let's do it.
But on health savings accounts is one way to be able to do that. So your pre-tax dollars, allowing you more power and more control over how you spend that, is one way to be able to do that. I've got 3 bills that I've introduced. We can get into the specifics later on, but that would give you more access and more opportunities, more options. I think also recognizing that we can incentivize the private sector side. So the majority of people are on some type of employees provided insurance. If we can incentivize them to even allow you more power, when you're 24, you may not be thinking about insurance as being the benefit that you need, but when you're in your 30s and you've got, kids at home and they rely on it, you may pick and choose a job based on benefits. We need to make it as easy as possible for companies to be able to provide those benefits to their employees rather than insurance companies and the government.